everyone, welcome back. I want to thank you for joining me as we cover Chapter 10, the Cardiovascular System. Let's get started. Lesson 10.1, Anatomy and Physiology of the Cardiovascular System. We will recognize and use terms related to the anatomy and physiology of the cardiovascular system. Functions of the cardiovascular system. The term cardiovascular is comprised of combining form cardio and combining form vasculo with suffix "r", which we know means pertaining to. The function of the cardiovascular system is to provide a means of transportation for a variety of substances to and from the cells of the body. The heart acts as a pump, while the vessels act as pipes to deliver the transportation medium, the blood, to the cells. The primary substance that needs to be hauled away is carbon dioxide. You may have heard an alternative term, the circulatory system, used to name this system as well. Let's look at the specialists and specialties. The diagnosis, treatment, and prevention of disorders of the heart is the discipline of cardiology. Remember, logi is our suffix meaning the study of, and the specialist in this area is a cardiologist. Remember, logis is the one who studies. Pulmonary and systemic circulation. Circulation can be divided into two main areas, pulmonary circulation and systemic circulation. Pulmonary circulation begins with the right side of the heart. Notice that the blood is deoxygenated, where the blood is pushed out to the lungs to offload the carbon dioxide and pick up oxygen. Now oxygenated, the blood travels back to the left side of the heart, where it is pumped out and begins its route through the systemic circulation. Note the pulmonary circulation is about the exchange of oxygen and carbon dioxide with the cells of the lungs. Systemic circulation describes exchange of gases and substances between the blood and the cells of the body. The blood is pumped out of the left side of the heart through the aorta, which is the largest artery in the body, and to the system of arteries that divides into smaller areoles that end in tiny capillaries. The capillaries of the body tissues are the sites of exchange between the cell's fluids and the plasma of the circulatory system. The journey then begins back to the heart through the tiny veins called venules, then larger veins, and finally the two largest veins of the body, the inferior and superior vena cava. Arteries are thick and muscular, necessary properties to withstand the force of the heartbeat, while veins are thinner and have one-way vessels that prevent backflow of blood. Capillaries are tiny and thin enough to allow only one blood cell at a time to pass through them. Don't confuse aorto, combining form meaning aorta, with atrio, meaning atrium, or arterio, meaning artery, and lastly arteriolo, meaning arterial. These are all very easy to get confused. I recommend using your flashcards for this chapter. Anatomy of the heart. Remember, we have word parts cardio and corono, which we use in this section for heart. Your heart is about the size of your fist. It's located in the mediastinum of the thoracic cavity, slightly to the left of the midline. The pointed tip, which we know is the apex, rests just above the diaphragm. The area of the chest wall, anterior, which means in front of, anterior to the heart, is called the precordium. Pre is our prefix meaning before, cordio is meaning heart, and then is that structure. The arteries of the heart, important that they are the blood supply of the heart muscle, are called the coronary arteries. The two main coronary arteries are called the left and the right coronary arteries. They supply a constant, uninterrupted blood flow to the heart. The areas of the heart wall that they feed are designated as inferior, lateral, anterior, and posterior. Here you can see a diagram of the heart. I really enjoy this image because I feel that it really shows the deoxygenated superior vena cava, inferior vena cava that feed into that right atrium. And then how you can see it go into kind of the purple, which is the pulmonary artery. Remember, that's going back to the lungs so that it can get reoxygenated. And you can see on the right side of this image where we have the pulmonary veins, that's returning the oxygen-rich blood to the to the left atrium, down through to that left ventricle, and then up and out through the aorta into the rest of the body. You'll notice the heart has 4 chambers. The upper chambers are the atria. Singular would be atrium. and the lower chambers are the ventricles. Both are divided into right-sided and left-sided chambers. Between the atria and ventricles, and between the ventricles and the vessels, are valves that allow blood to flow in only one direction. The walls between the chambers are called the septa, or singular form is septum. Between the atria, it is the interatrial septum, and between the ventricles, it is the interventricular septum. Remember, inter is our prefix for between, atrio is our combining form for atrium, and al is our suffix for pertaining to. Same with ventriculo means ventricle. Aside from the 4 chambers, the heart is composed of 3 layers. The endocardium is the thin tissue that acts as a lining for each of the chambers. Then we have the myocardium, which is the cardiac muscle surrounding each of these chambers. The pericardium, however, is the double-folded layer of the connective tissue that surrounds the heart. Its inner surface is called the visceral pericardium. Remember, viscero is our combining form for organ, so it is the side that is closest to the organs of the heart. While the outer membrane, closest to the body wall, is called the parietal pericardium. Another name for the visceral pericardium is the epicardium, because it is the structure at the top of the heart. Remember, epi is that prefix for above or on top of. The combining forms for these layers will be given as compound combining forms: endocardio, myocardio, and pericardio. Now that you understand their derivations. Now that we got some of that anatomy out of the way, let's look at the blood flow through the heart. Deoxygenated blood is returned to the heart through the superior and inferior vena cava to the right atrium. Remember, that's the top portion, that smaller portion. When the right atrium contracts, the blood passes through the tricuspid valve into the right ventricle. That's the right lower portion. When the right ventricle contracts, the blood is pushed into the pulmonary arteries to the lungs. Note that these are the only arteries that carry deoxygenated blood. You may see that on a test. These arteries deliver the deoxygenated blood to the capillaries of the lungs, where carbon dioxide leaves the blood and oxygen is picked up to begin the cycle of delivering oxygen to the cells all over again. Now that our blood is reoxygenated, it travels from the capillaries of the lungs to the pulmonary veins. Note that this is the only oxygenated blood in veins throughout the body. Again, you might see that one on a test. The pulmonary veins deliver the oxygenated blood to the left atrium. Remember, that's the top portion on the left. When the left atrium contracts, the blood passes through the bicuspid valve, also known as the mitral valve, to the left ventricle. Remember, that is the lower left portion. Upon contraction of the left ventricle, the blood travels through the aortic semilunar valve to the largest artery in the body, which we know as the aorta. The amount of blood expelled from the left ventricle compared with the total volume of blood filling the ventricle is referred to as the stroke volume and is a measure of the ejected fraction of cardiac output. Think of these as a measure of the strength and efficiency of the heart muscle. The normal reading is around 65% for the ejection fraction. Any percentage under that may indicate disease. The measure of the heart rate is calculated in beats per minute. Normal range is from 60 to 100 beats per minute. The areas of measurement around the body are pulse points. Now let's take a look at the cardiac cycle. The cardiovascular system is dependent on the coordinated contractions and relaxations of the heart muscle. When this force, the blood pressure, is measured by an instrument termed a sphygmomanometer, which many know as a blood pressure cuff, the reading is measured as systole, which is the contractive phase, over distole, which is the relaxation phase. I like to remember this as systole. Think of a system. It's always working, right? So that's the contraction phase. With diastole, think of day in Spanish means dia, right? So you rest after a long day. So diastole is that relaxation phase. Normal blood pressure is a range from 120 to 139 over 80 to 89. The timing of the contractions and relaxations is accomplished through the electrical pathways in the heart. The heartbeat begins with the sinoatrial node, which we know as the natural pacemaker of the heart. This initial signal causes the atria to contract. The signal then is sent to the arterioventricular node, located at the base of the right atrium, proximal to the interatrial septum. From the arterioventricular node, the signal travels to the bundle of His, also called the arterioventricular bundle, in the intraatrial septum. Its right and left bundle branches transmit the impulses to the Purkinje fibers in the right and the left ventricles. Once the Purkinje fibers receive stimulation, they cause the ventricles to contract and force the blood out of the pulmonary arteries and the aorta. Normal electrical activity is referred to as normal sinus rhythm, or NSR. An abnormality of the signal may result in an arrhythmia, which is an abnormal heartbeat. Lesson 10.2, Pathology of the Cardiovascular System. We're going to recognize and use terms related to the pathology of the cardiovascular system. Terms related to the cardiac signs and symptoms. First, we have bradycardia. Remember, this is Brady, this is not the Brady Bunch. So brady is our prefix meaning slow, and cardia is our suffix meaning heart condition. So bradycardia is a slow heartbeat with ventricular contractions less than 60 beats per minute. On the other hand, we have tachycardia. Tachy is our prefix meaning rapid. Again, cardia means heart condition. So tachycardia is a rapid heartbeat of more than 100 beats per minute. Then we have cardiodynia. Dynia is our suffix for pain. So therefore, cardiodynia is heart pain that can be described as atypical or ischemic. Atypical, remember A meaning no, not without, is a stabbing or burning pain that is variable in location and intensity and unrelated to exertion. Ischemic pain is a pressing, squeezing, or weight-like cardiac pain caused by decreased blood supply that usually lasts only minutes. Precordial pain, remember pre is our prefix for before or in front of, cardio means heart, and all is that pertaining to. This is a pain in the area over the heart. Then we have cardialgia, and cardiodynia are synonyms. They both mean the same thing. Remember, algia and dynia are both suffixes for pain. Then we have cardiomegaly. Megaly is our suffix for enlargement. So this is the enlargement of the heart. Then we have cyanosis. Cyano is a combining form for the color blue. And osis is our abnormal condition suffix. And this is a lack of oxygen in the blood, seen as a bluish or grayish discoloration of the skin, nail beds, and or lips. Then finally we have diaphoresis, and this is profuse secretion of sweat. Here we have some more symptoms. Claudication is a cramp-like pain in the calves caused by poor circulation in the leg muscles. Then we have dyspnea. Dys is our prefix for difficult, and then pnea means breathing. So dyspnea on exertion, which is abbreviated DOE, is difficult and or painful breathing when effort is expended. Then we have edema, which is abnormal accumulation of fluid in the interstitial spaces of tissues. Then we have nausea, which is the sensation that accompanies the urge to vomit, but does not always lead to vomiting. Emesis, on the other hand, is the forcible or involuntary emptying of the stomach through the mouth. A bruit is an abnormal sound heard when an artery is auscultated. It is usually a blowing or swishing sound, more high-pitched than a murmur. A murmur is an abnormal heart sound heard during systole, diastole, or both, which may be described as a gentle blowing, fluttering, or humming sound. Then we have pallor, which is the paleness of the skin and or mucous membranes. On darker pigmented skin, it may be noted on the inner surfaces of the lower eyelids or on the nail beds. Ischemia is the lack of blood in a body part due to a blockage or constriction that interferes with normal blood flow. And now for the last signs and symptoms slide. We have palpitations. These are a pounding or racing of the heart, such as the patient is aware of his or her own heartbeat. You can actually feel it in your chest. Then pulmonary congestion, which is an excessive amount of blood in the pulmonary vessels. It usually is associated with heart failure. Then we have shortness of breath, which you may see documented as SOB, which is breathless air hunger. And then we have syncope, which is fainting or a loss of consciousness. A thrill is a fine fibrillation felt by the examiner on palpitation. Venous distension is an enlarged or swollen vein. Be careful. Do not confuse palpation, which means examination by touch, and palpitation, which means pounding or racing of the heart. Now let's look at some terms related to congenital disorders of the heart. Remember, congenital means that they're born with it. First, we have coarctation of the aorta, and it is a congenital cardiac anomaly characterized by a localized narrowing of the aorta. Coarctation is another term for a narrowing. Then we have patent ductus arteriosus. Usually you'll see this documented as PDA. And it is an abnormal opening between the pulmonary artery and the aorta caused by failure of the fetal ductus arteriosus to close after birth, most often in premature infants. Patent means open. Occluded means closed or blocked. Then we have the septal defect, which is any congenital anomaly of the walls between the heart chambers. An atrial septal defect, known as ASD, is a hole in the wall between the upper chambers of the heart. A ventricular septal defect, known as VSD, is a hole between the wall and the lower two chambers of the heart. And then finally we have tetralogy of Fallot. Tetra is our prefix meaning four, and logy is the study of. So this is a congenital cardiac anomaly that consists of four defects. Those are pulmonic stenosis, ventricular septal defect, malposition of the aorta, so that it arises from the septal defect or the right ventricle, and right ventricular hypertrophy. A good way to remember tetra means four is think of the game Tetris. Each block part has 4 blocks in it. Tetra means 4. Now we're going to look at terms related to valvular heart disease. Aortic stenosis, remember stenosis means narrowing, is a narrowing of the aortic valve, which may be acquired or congenital. Then we have mitral stenosis, which is a narrowing of the valve between the left atrium and the left ventricle, caused by adhesions on the leaflets of the valve, usually the result of recurrent episodes of rheumatic endocarditis. Left atrial hypertrophy develops and may be followed by right-sided heart failure and pulmonary edema, which we also know as cor pulmonale. The term mitral is derived from the appearance of the valve and its similarity to a bishop's mitre or hat. And lastly, we have tricuspid stenosis, which is a relatively uncommon narrowing of the tricuspid valve associated with lesions of other valves caused by rheumatic fever. Symptoms include jugular vein distension and pulmonary congestion. Now we have mitral regurgitation, which is the backflow of blood from the left ventricle into the left atrium in systole across a diseased valve. It may be the result of a congenital valve abnormalities, rheumatic fever, or mitral valve prolapse. Mitral valve prolapse, remember pro is our prefix for forward and lapse is our suffix meaning fall. So this is a protrusion of one or both cusps of the mitral valve back into the left atrium during ventricular systole. Next we have orthopnea. Ortho is our combining form for straight or upright, and again pnea means breathing. It is a condition in which a person must sit or stand to breathe comfortably. And finally we have valvulitis, which is the inflammatory condition of the valve, especially a cardiac valve, caused most commonly by rheumatic fever and less frequently by bacterial endocarditis or syphilis. Results are stenoses and obstructed blood flow. Now let's review some terms that are related to cardiac dysrhythmias. Let's look at these first two terms, dysrhythmia versus arrhythmia. So with dysrhythmia, we have a prefix dys meaning abnormal. Rhythmo is our combining form for rhythm, and our suffix ia is our condition. Therefore, dysrhythmia is an abnormal heartbeat. And arrhythmia, remember A is our prefix for no, not without, which is a synonym of dysrhythmia. Next we have ectopic beats. Our prefix ek means out of, and then our combining form topo means place, and then ik is again our pertaining to. These are heartbeats that occur outside of a normal rhythm. Let's look at the difference now between atrial and ventricular. So atrial ectopic beats are irregular contractions of the atria. These are also termed premature atrial contractions, or PAC, PAC. Ventricular ectopic beats are irregular contractions of the ventricles. These are also called premature ventricular contractions, PVC. These are not always considered pathologic, meaning they're not always caused by a disease. Then we have fibrillation, which is an extremely rapid and irregular contraction, usually 300 to 600 per minute, that occurs with or without an underlying cardiovascular disorder, such as coronary artery disease. Now within this, we have atrial fibrillation and ventricular fibrillation. So atrial fibrillation is the most common type of cardiac arrhythmia. It is associated with excessive alcohol consumption, whereas ventricular fibrillation is rapid, irregular contractions that may be fatal unless reversed. Then we have flutter, which is an extremely rapid but regular heartbeats, 250 to 350 a minute. Atrial flutter is an extremely rapid but regular atrial rhythm. Heart block is the result of a lack of electrical communication between the atria and the ventricles. It is also called arterioventricular block. Then we have bundle branch block, which is an incomplete electrical conduction in the bundle branches on either the left or the right side. Then we have sick sinus syndrome, which is any abnormality of the sinus node. It may necessitate the placement of an implantable pacemaker. Then we have ventricular tachycardia. Remember, tachy is our prefix meaning rapid, cardia again, heart condition. So this is the condition of ventricular contractions that are greater than 100 beats per minute. Now we'll go over some terms related to other disorders of coronary circulation. First, we have angina pectoris. Pectoro is our combining form meaning chest, and is a structure suffix. Angina pectoris is a paroxysmal chest pain that is often accompanied by shortness of breath and a sensation of impending doom. Then we have coronary artery disease, abbreviated CAD. Corono, again, remember, means heart or crown. This is the accumulation and hardening of plaque in the coronary arteries that eventually can deprive the heart muscle of oxygen, leading to angina. CAD is the leading cause of death in both sexes in the United States, accounting for 1/3 of all deaths each year. And next we have myocardial infarction. This is abbreviated MI. You may see that on a test. Myocardial infarction is cardiac tissue death that occurs when the coronary arteries are occluded or blocked by an atheroma, a mass of fat or lipids on the wall of an artery, or a blood clot caused by an atheroma, and thus are unable to carry enough oxygenated blood to the heart muscle. Depending on the area affected, the patient may die if enough heart muscle is destroyed. This is commonly called a heart attack. Remember, heart attack equals myocardial infarction, heart attack equals MI. A silent heart attack is one that the patient is not aware of, usually because it destroys such a small amount of tissue. A massive heart attack is one that destroys a large amount of tissue, often enough to be fatal. When a person is in the process of having a heart attack, it is called an acute myocardial infarction, or an AMI. Be careful! Infarction refers to tissue death, and infraction refers to a breaking, as in an incomplete bone fracture. Let's look at some other terms related to cardiac conditions. So first we have cardiac tamponade, which is the compression of the heart caused by fluid in the pericardial sac. Then we have cardiomyopathy. Remember, cardiomyo is our compound combining form, meaning heart muscle, and then pathy is our suffix for disease or diseases. So this is a progressive disorder of the ventricles of the heart. Heart failure is an inability of the heart muscle to pump blood efficiently so that it becomes overloaded. The heart enlarges with unpumped blood and the lungs fill with fluid. This was previously referred to as congestive heart failure. Now it's just heart failure. Then we have endocarditis. Remember, endocardio is a compound combining form, meaning within the heart, or talking about the endocardium. And then itis is our suffix for inflammation. So therefore, this is the inflammation of the endocardium and the heart valves, characterized by lesions and caused by a number of different microbes. Although the number of cases of endocarditis has not changed over the past few decades, twice as many men as women are diagnosed with this condition. And lastly, we have pericarditis. Remember, pericardio is our compound combining form, meaning pericardium, which we're talking about around the heart. And then itis again is inflammation. So this is the inflammation of the sac surrounding the heart with the possibility of pericardial effusion. Now let's look at terms related to vascular disorders. First we have arteriosclerosis. Arterio is our combining form for artery. Sclerosis is an abnormal condition of hardening. Therefore, this is a disease in which the arterial walls become thickened and lose their elasticity. without the presence of atheromas. Remember, athero means fat or plaque, and oma means mass. Arteriosclerosis is the leading cause of morbidity and mortality in the United States today. Atherosclerosis, remember athero means fat or plaque, sclerosis is the abnormal condition of the hardening. This is a form of arteriosclerosis in which medium and large arteries have atheromas, which can reduce or obstruct blood flow. Patients with peripheral atherosclerosis complain of intermittent claudication. An aneurysm is a localized dilation of an artery caused by a congenital or acquired weakness in the wall of the vessel. The acquired causes may be arteriosclerosis, trauma, infection, and/or inflammation. Esophageal varices are varicose veins that appear at the lower end of the esophagus as a result of portal hypertension. They are superficial and may cause ulceration and bleeding. I do want to point out that an aneurysm, beginning with A, is a dilation of an artery, also beginning with an A. And a varicosity is a dilation of a vein. Notice they both have the V's. So varicosity, vein, aneurysm, artery. And then finally we have hemorrhoids. Hemorrhoids are varicose conditions of the external or internal rectal veins that cause painful swelling at the anus. Next we have hypertension, which could be abbreviated HTN. Remember, hyper means excessive and tenso is our combining form for stretching, and then ION is our suffix for process of. So this is a condition of high or elevated blood pressure, also known as arterial hypertension. It occurs in two main forms: primary, or sometimes called essential hypertension, which has no identifiable cause, and secondary hypertension, which occurs in response to another disorder. Then we have malignant hypertension, which is very high blood pressure that results in having organ damage. Almost 1 in 5 Americans has been diagnosed with hypertension. Then we have hypotension. Remember, hypo means below or deficient. And again, tenso is meaning stretching, and the ION is our suffix for process of. So this is a condition of below normal blood pressure. Orthostatic hypotension occurs when a patient experiences an episode of low blood pressure upon rising to a standing position. Then we have peripheral arterial occlusion. Occluso means blockage, and then ION is our process of. This is the blockage of blood flow to the extremities. Acute or chronic conditions may be present, but patients with both types of conditions are likely to have underlying atherosclerosis. Then finally we have peripheral vascular disease, which we know as PVD. It is any vascular disorder limited to the extremities. It may affect not only the arteries and veins, but also the lymphatics. Next we have one of my favorites, just because it's so interesting and fascinating. We have Raynaud's disease, which you may also see being called Raynaud's phenomenon. It is an idiopathic disease, which means it has an unknown cause, of the peripheral vascular system that causes intermittent cyanosis and erythema of the distal ends of the fingers and toes, sometimes accompanied by numbness. It occurs almost exclusively in young women. The presentation is bilateral, meaning both sides. Raynaud's phenomenon is secondary to rheumatoid arthritis, scleroderma, or trauma. The presentation is unilateral, meaning one side. You may also see Raynaud's phenomenon as the red, white, and blue. Usually it starts off with white because there's no flow, and then it becomes a blue or dusky because it's lack of oxygen, and then finally once blood flow returns, you'll see it turn red. Next we have thrombophlebitis. Thrombo means clotting or clot. Phlebo means vein, and again, itis means inflammation. So this is the inflammation of either deep veins, such as deep vein thrombosis or DVT, or superficial veins, superficial vein thrombosis, or SVT, with the formation of one or more blood clots. Then we have varicose veins, which are elongated, dilated superficial veins, varices is what we know them as, with incompetent valves that permit reverse blood flow. These veins may appear in various parts of the anatomy, but the term varicose veins has been reserved for those in the lower extremities. Then we have vasculitis. Vasculo means vessel, and itis, again, inflammation. It is the inflammation of the blood vessels. It is also called angiitis. Let me explain angiitis real quick, because when you look at it, it's ANGIITIS. Now, if we had our combining form, it would be angio. But remember, itis starts with a vowel, so we don't need it. We drop the O. That's why we have two I's together instead of just dropping another letter. So angiitis is how it would be pronounced. Terms related to benign neoplasms. Remember, benign means non-cancerous. First, we have atrial myxoma. Myxo means mucus and oma means tumor or mass. This is a benign growth, usually occurring on the interatrial septum. Then we have hemangioma. Hemangio is a compound combining form, meaning blood vessel, and oma again means tumor or mass, and it is a non-cancerous tumor of the blood vessels. It may be congenital, such as a stork bite is what they might be called, or may develop later in life. Now let's look at some terms related to malignant neoplasms. Remember, malignant means cancerous. So cardiac myxosarcoma, remember myxo is that mucus, sarcoma is that connective tissue cancer. And it is a rare cancer of the heart, usually originating in the left atrium. Then we have hemangiosarcoma. Hemangio again means blood vessel. Sarcoma is connective tissue cancer. This is a rare cancer of the cells that line the blood vessels. And you can see an image of that here. Again, age matters. So with pediatric, we have congenital disorders in this system. In geriatric, we have issues such as hypertension, coronary artery disease, myocardial infarction, arrhythmias, and peripheral vascular disease. Note that pediatric disorders are all congenital, whereas the disorders of the elderly are often the result of lifestyle choices. Lesson 10.3, Diagnostic Procedures and Therapeutic Interventions for the Cardiovascular System. We'll recognize and use terms related to the diagnostic procedures and therapeutic interventions for the cardiovascular system. Terms related to general diagnostic procedures. Blood pressure is the measure of systolic pressure over diastolic pressure. The instrument used for this measure is a sphygmomanometer, literally an instrument to measure. Remember, meter is our suffix for measure. Pulse means sphygmo, and pressure is mano. Auscultation is listening, and percussion is tapping, and it is a diagnostic technique used to detect differences in density within a body cavity. The instrument that amplifies the sound within the body is a stethoscope. Stetho is a combining form for chest, and scope is a suffix for instrument to view, although here it is to examine. Now let's review some terms related to imaging. First, we have echocardiography. Echo is our prefix for reverberation, and cardio means heart, and graphy is the process of recording. This is the use of ultrasonic waves directed through the heart to study the structure and motion of the heart. Transesophageal echocardiography, remember trans means through, images the heart through a transducer introduced into the esophagus. Then we have exercise stress tests. These are images of the heart during exercise on a treadmill with the use of a radioactive thallium or technetium systemib, also called an exercise electrocardiogram. Finally, we have an MRI, or magnetic resonance imaging. It is a computerized imaging that uses radio frequency pulses in a magnetic field to detect areas of myocardial infarction, which we know as tissue death, or stenosis, areas of narrowing, and areas of blood flow. Next, we have multiple gated acquisition, also known as MUGA scans. These are non-invasive methods of imaging a beating heart by tagging RBCs with a radioactive substance. A gamma camera captures the outline of the chambers of the heart as the blood passes through them. Myocardial perfusion imaging is the use of radionuclides to diagnose CAD, valvular or congenital heart disease, and cardiomyopathy. Positron emission tomography is a computerized nuclear medicine procedure that uses inhaled or injected radioactive substances to help identify how much a patient will benefit from revascularization procedures. This positron emissions tomography is also known as a PET scan. Then we have radiography, in the form of chest x-rays, used to evaluate the size and the shape of the heart in posterior and anterior and lateral views. And lastly, we have phlebography. Remember, phlebo means vein, and graphy is that process of recording. This is an x-ray of a vein after the introduction of a contrast dye. Next we have angiocardiography. Remember, angio means vessel, that's our combining form for vessel. Cardio is combining form for heart, and graphy again is that suffix for process of recording. Angiocardiography is the injection of a radiopaque substance during the cardiac catheterization for the purpose of imaging the heart and the related structures. Then we have digital subtraction angiography. Remember, sub means under, tracto is our combining form for pulling, and ION is that process of. Digital subtraction angiography is the digital imaging process wherein contrast images are used to subtract the non-contrast image of surrounding structures, leaving only a clear image of the blood vessels. You can see in this picture below how they have removed it in the lower images, and you can clearly see all of those vessels. Cardiac catheterization is the threading of a catheter, which is a thin tube, into the heart to collect diagnostic information about the structures in the heart, coronary arteries, and great vessels. It is also used to aid in the treatment of CAD, congenital abnormalities, and heart failure. A Swan-Ganz catheter is a long, thin cardiac catheter with a tiny balloon at the tip and is fed through the femoral artery near the groin and extended up to the left ventricle. This instrument is used to determine left ventricular function by measuring pulmonary capillary wedge pressure. Then lastly we have fluoroscopy, which is an X-ray procedure that allows visualization of structures in real time directly on a monitor screen. The combining form fluoro means to flow, as this image procedure is a flow of images, not a static image. Next we have electrocardiography. Remember, electro is our combining form for electricity, cardio again means heart, and our suffix graphy is that process of recording. Therefore, this is a recording of the electrical impulses of the heart as wave deflections of a needle on an instrument called an electrocardiograph. Graph, however, is our suffix for instrument used to record. The record or recording is called an electrocardiogram. Think of Instagram. You know, you have that picture or that record that you have posted. Gram is that recording. Then we have Holter monitor, which is a portable electrocardiograph that is worn to record the actions of the heart to daily activities. Let's look at some related laboratory tests. First, we have the cardiac enzyme tests that are blood tests that measure the amount of cardiac enzymes characteristically released during a myocardial infarction. They determine the amount of lactase dehydrogenase and the creatinine phosphokinase in the blood. The lipid profile is a blood test to measure the lipids in circulating blood. Remember, lipids is also that cholesterol and triglycerides. Then we have phlebotomy. Remember, phlebo means vein. Tomy is our suffix for incision. This is an opening of a vein to withdraw a blood sample. It is also referred to as a venipuncture. Next, we're going to review some cardiac procedures. An atherectomy, remember athero means fat or plaque, and ectomy is that removal. Therefore, this is the removal of plaque from the coronary artery or other arteries through a catheter with a rotating shaver or a laser. If a laser is used, the procedure is termed laser angioplasty, and the plaque is vaporized by pulsating beams of light through a catheter introduced into the coronary artery to the site of the blockage. It may be used alone or with a balloon angioplasty. Then we have a commissurotomy. This is a surgical division of a fibrous band or ring connecting the corresponding parts of a body structure. It is commonly performed to separate the thickened, adherent leaves of a stenosed mitral valve. A carotid endarterectomy, remember end is within, artero means artery, and ectomy is that removal. Therefore, this is the removal of the atheromatous plaque lining the carotid artery to increase blood flow and to leave a smooth surface. The procedure is done to prevent thrombotic occlusions, also known as blockages. Then we have a thromboendarterectomy, which is the removal of a blood clot along with possible part of the lining of the artery and possibly associated plaque, which you can see in this image below. Cardiac pacemakers are small, battery-operated devices that help the heart beat in a regular rhythm. They can be either internal, which means they're permanent, or external for temporary. An automatic implantable cardioverter defibrillator, an AICD, is a device that is implanted in the chest to monitor the heartbeat and correct it if needed. meaning to either speed it up or slow it down. A cardiac defibrillator is either an external or implantable device that provides an electronic shock to the heart to restore the normal rhythm. Then we have cardiopulmonary resuscitation, which we know as CPR, and is a manual external cardiac massage and artificial respiration used to restart the heartbeat and breathing of a patient. Fun fact, even if you are not comfortable with giving breaths, just doing chest compressions alone until help arrives could still save someone's life. Don't become a victim of the bystander effect, which in turn could create a victim who actually loses their life. Next, we have coronary artery bypass graft, which in the field you might see abbreviated and pronounced as CABG. This is a surgery that is open heart procedure in which a piece of blood vessel from another location is grafted onto one of the coronary arteries to reroute blood around the blockage. Then we have extracorporeal circulation, ECC, which is the use of a cardiopulmonary machine to do the work of the heart during open heart procedures. Then heart transplant is the removal of a diseased heart and transplantation of a donor heart when cardiac disease can no longer be treated by any other means. Next we have left ventricular assistance device, which is a mechanical pump device that assists a patient's weakened heart by pooling blood from the left ventricle into the pump and then injecting it out into the aorta. LVADs may be used on those patients awaiting a transplant. And lastly, we have a minimally invasive direct coronary artery bypass, which is a surgical procedure in which the heart is still beating while a minimal incision is made over the blocked coronary artery and an artery from the chest wall is used as the bypass. Let's look at this first term, percutaneous. So per is our prefix meaning through, cutaneo means skin, and us is pertaining to. So this is pertaining to through the skin. And we have transluminal. Trans also means through. Lumino means lumen, and then all is pertaining to. And then we have coronary angioplasty. Remember, angio means vessel, plasty is our suffix for surgical repair. Therefore, this is a surgical procedure in which a catheter is threaded into the coronary artery that is affected by atherosclerotic heart disease. The balloon at the tip of the catheter is inflated and dilated to compress the plaque against the wall of the artery and increase blood flow. Stents, which are a wire mesh tube, is placed in the arteries and used to prop them open after the angioplasty. Recent studies show cases of in-stent restenosis, which is a narrowing of the lumen of a stent. Then we have pericardiocentesis. Pericardi is our compound combining form for pericardium, and then centesis is that surgical puncture. Therefore, this is an aspiration of fluid from the pericardium to treat cardiac tamponade. And finally, we have a port access coronary artery bypass, which is a procedure in which the heart is stopped and a bypass surgery is accomplished through small incision in the chest wall. Radiofrequency catheter ablation is the destruction of abnormal cardiac electrical pathways causing arrhythmias. Transmyocardial revascularization is a procedure used to relieve severe angina in a patient who cannot tolerate a coronary artery bypass graft or a percutaneous transluminal coronary angioplasty. With a laser, a series of holes is made in the heart tissue in the hope of increasing blood flow by stimulating new blood vessels to grow. This is known as angiogenesis. Angio is our combining form for vessels, and genesis means production. Then we have valvuloplasty. Valvulo is our combining form for valve, and remember, plasty is that suffix for surgical repair. This is the repair of a stenosed heart valve with the use of a balloon-tipped catheter. Our last category is pharmacology. Angiotensin, remember angio is our combining form for vessel, tenso means stretching, and in is our substance. So this is converting enzyme, like an ACE inhibitor, are drugs that relax blood vessels by preventing the formation of the vasoconstrictor angiotensin II. This inhibition causes a decrease in water retention and blood pressure, and an improvement in cardiac output. ACE inhibitors are commonly used to treat hypertension and heart failure. An example would be like Linapro. Angiotensin II receptor blockers, ARBs, are drugs that lower blood pressure by inhibiting angiotensin II from binding its action sites. Example would include Avapro. Antiarrhythmic drugs work via various mechanisms to treat cardiac arrhythmias and restore normal sinus rhythm. Example would include Lanoxin. Then we have anticoagulants. Remember, anti is our prefix for against, and coagulant means clotting. So these are drugs used to prevent the formation of blood clots. Examples would include warfarin and heparin. Then we have anti-hyperlipidemics. Remember, anti is our prefix for against, hyper also means excessive, and then lipido is fat, and emic means pertaining to a blood condition. Therefore, these are drugs that lower cholesterol levels to reduce the risk of heart attack or stroke. There are 5 different types. Beta blockers are drugs that depress the heart rate and the force of the heart contractions by decreasing the effectiveness of the nerve impulses to the cardiovascular system. They typically are prescribed to treat angina pectoris, hypertension, and cardiac arrhythmias. An example of this would be Inderal. Calcium channel blockers, or CCBs, are drugs that decrease myocardial oxygen demand by inhibiting the flow of calcium to smooth muscle cells of the heart to cause arterial relaxation. They are used to treat angina, hypertension, and heart failure. An example includes Norvasc or Procardia. Diuretics are drugs that promote the excretion of sodium and water as urine. They are used in the treatment of hypertension and heart failure. Examples of diuretics are Lasix and hydrodiural. Next we have nitrates, which are anti-anginals. These are drugs that relax blood vessels and reduce myocardial oxygen consumption to decrease the pain of angina pectoris. They are also used to treat hypertension and heart failure. Examples would include nitro or nitrodur. Nitroglycerin can be administered sublingually, which means under the tongue, intravascularly, which means within the vessel, or through a transdermal patch. Trans means through, dermal means skin. Then lastly, we have thrombolytics. Remember, thrombo means clot and lytic is pertaining to breaking down. These are drugs that aid in the dissolution of blood clots, also known as clot busters, which are used to treat obstructing coronary thrombi. Thrombi is plural for a clot. Examples are tissue plasminogen activators, known as TPAs, streptokinase, alteplase, reteplase, and tenecteplase. All right, everyone, that's all I have for you today. Thank you so much for joining me, and I will see you on our next chapter. Have a good one. Bye.